Now I will stop there. So, Terza.
And just to add to that, that there is already proven success to this, because thanks to Colin along the way, advising individuals that found themselves in this crossroads of having to fight against the council, and Colin supported them with the information and guidance, you did have successes already. So
yes, it does work. It does work.
It does work. Just one case that I remember of an elderly woman who lived at home and needed 24 hours care. She needed a live-in carer, but the councils wouldn't normally give more than 4 care visits a day. So which means that she would have remained on her own. I mean, living out the fact that her son lived with her, but anyway, she was put by social services under pressure that if she wants a live-in carer, she has to move to a care home, and she absolutely didn't want this. And Colin supported through this process or through the challenge to the council on how they implement the Care Act. You helped the son to challenge the council, and they did get the funding for basically for a live-in carer, which is, as a social worker, I can tell you, is unheard of. So we work, and you're right in that to say that social workers, in the circumstances of resources, lead the eligibility needs, we are working within the framework of knowing I'm not going to get for my client more than 4 visits a day, so I'm not even going to try it. So that's and I think that will be the fantastic advantage of the website that Charlie is building, which is brilliant. And I think, and you tell me, Charlie, if I'm right, because you've tested it with a few people, a few service users. So I know a couple of people on this meeting now that had tried it and then fed back their critique, and that helped to improve. Do you still need more people to try it and in order to improve it?
Yeah, I mean, at the stage we're at now, and I have to say this is a collaborative process. This is not entirely me doing this. We are working as a team to get the website to the best place possible. And yeah, I've had some really, really useful feedback from people, so that we can kind of try and condense it down, because one of the issues we have is accessibility, basically, for a very stressful life that people who are in need of care and support and their carers have. We don't want the website to add another stress to that. We want the website to be really helpful and for the process to be not laborious like most of the other processes are that they have to undertake. So yeah, I think we do need more. We've had some meetings with people. There's talk of also people who are going into social work, perhaps looking at the website, because in reality, most of the people who are using it will probably be some kind of advocate for the person, either the family member or yeah, so we're hoping that it's going to work for everybody, no matter where they're coming at it from, whether they're an individual who's not doesn't have a social worker or somebody who does. And I think another important thing to state is that the process of doing this, the process of giving people the tool with which to identify their own needs, actually links in with what Colin was saying about understanding the full level of resource that is needed, and that by people identifying their needs as they see them, which is the way the Care Act says, we would get a much better idea of how much resource is actually needed, to fund something like a national care service. And until we've done that exercise of people actually saying that, then it's very, very difficult to actually understand how much would be needed. So we're trying to work with people across the movement of the disabled people's movement, to kind of have this as part of the process that leads to the ultimate, which is that everybody achieves independent living, and that we have some kind of national care service akin to the National Health Service.
Thanks, Charlie. Open to question. I have a couple of questions, but later. So unmute yourself and or put your hand up and ask your questions. Deafening silence.
Sorry, I would just like to ask, it's not, excuse me if I don't get it out as a good question to begin with, you'll have to help me phrase it. Thinking in terms of cuts to learning disabilities, cuts to services that may more indirectly impact onto people with disability and older people, cuts in general from Barnet Council. How do we balance that with the fact that it is very difficult to have an overall knowledge of, like it's been said, knowledge of what the need is, and yet to have these cuts? How can we be, you know, cuts in general, we can campaign about it because it's a cut, but when we're not so easily aware of the implications broadly, how somebody's family, how all sorts of people are affected, how can we make this more evident, really, particularly to people who may not be affected? I think if you're, you know, if you've never needed an operation and you've never needed a blood test, you don't necessarily know how important the NHS is. Maybe with social care, not everybody's affected and therefore doesn't always kind of get it and get what happens when we get these cuts. And also, Colin, some kind of an idea of the breadth. We've talked about independent living and care homes, but the breadth of social care.
Yeah.
Oh.
Well, shall I make a comment about your first question, which I heard, Jenny, along the lines of how can we mobilize? How can we how can we make our voice heard?
Yeah.
And it's a very important question. And one of the reasons why the system has survived for as long as it has is because there isn't that degree of mobilization. And the reason I believe that there isn't is that what we encounter largely amongst these about 5,000 people in Barnet that receive care and support, the great majority of them are fearful and they're very vulnerable. And they are frankly grateful for anything that they can get, because it's quite I don't know if you've been through it, but it can be quite an intimidating process. You know, by virtue of whatever it is your condition is, you are vulnerable. You're in need of care and support. You know, you're at a vulnerable point in your life, and you find yourself at the mercy of a bureaucracy whose decision making you don't necessarily understand. It happens behind closed doors. The social worker comes out and talks to you, but the decision is made by somebody else. So quite often people are simply grateful, and there isn't the information upon which to build any kind of campaign around funding levels. You know, it happened 3 or 4 years ago in the way that Terza said, that the council rather exposed itself. Mostly it happens behind closed doors to unknown people and unknown numbers. It's a very kind of hidden thing. Now, if the change came about that we think should happen, which is the Care Act is properly implemented and everybody's needs are identified and costed on the basis of what they need for their well-being without regard to the available resource, the position would be completely changed, because it would be public knowledge that Barnet spends is £90 million, but Barnet needs to spend, I don't know what it would be, let's say 100 million, 120, 130, 140 million. And then there is a public debate. There is a public debate which involves the politicians, the professionals, members of the community. Everybody knows what the position is. The problem is at the moment, it's all so covert and secret. So it's very difficult to mobilize people. And that's one of the problems. The question in terms of breadth, Jenny, I wasn't quite sure what you meant by that question.
Oops. Oh, yes. So, for instance, does social care affect families with children who, even while their needs may be met by family and school, etc., but are showing that over life they're going to need to be down to be funded, because that's going to affect them in terms of being able to support themselves, even have laptops so that they can fill in self-assessment forms. You know, lots of indications come early on in life.
Yes.
So Jenny, if I can, if I understand you, if I can rephrase it. So you're asking, how do we, in order to mobilize, we need to widen the public that identifies with this question, and you're asking, is that what you're asking?
Yeah.
How do we include in the people? Because over the years, BAPS exists, 10 years or 12 years or something like that, and we have campaigned on social care issues, and we noticed a pattern that they are less sexy. I mean, there will be more people on the street stalls that will say, I'm not interested, it doesn't touch me, than on if we campaigned, I don't know, on other issues. Other people can give examples. So I think that's what you're asking, how do we really include everyone? And I think if I understood you, Colin, what you're really suggesting is for us to campaign, what we need to campaign perhaps, as a question, is for the council to record need, because once we will have this need, or perhaps it was Jenny that said, then we will be able to demonstrate by budget. If I understood correctly?
Yes, I think I think that's right. I think that's right. So it would be, if there were to be any kind of campaign momentum, it would be around getting the council to change the way it works and to be honest about need, to be honest about its resources. I mean, what councils say is they need more money, and they may or may not. Basically, we don't know, because they don't reveal the gap between needs and funding. So if there were to be a campaign mobilized, I'm not a great campaign mobilizer. I'm basically a social worker, a social care consultant. The thing that as a resident, my local council gets me angry, it is the lack of honesty within the system. So if there were to be any kind of street level campaign around messages, it would be to be honest, to be honest in the way that the Care Act actually allows you to be honest, and actually requires you to be honest. I mean, I don't know if a campaign could be developed sort of around that with any kind of momentum. The council is now very, very sensitive to the issues that we've raised. I think we can be sure of that. Over the past few years, they've had to deal with us. They think they have dealt with us. I think they've seen us off, but they're aware of the issues. So it won't come as a shock to them. For sections within the community to be coming at them and saying, we need you to be more honest with us about what's actually going on. about what people's needs are.
I'm just looking at a letter here from Claudia Webb, who's written to Therese, whatever her name is, Coffey, about disability benefits. And she's talking about providing an appropriate assessor for people's PIP assessments and work capacity assessments. And I'm just wondering whether part of the problem here, Colin, might be that because funding is this sort of fragmented, you know, you can get some money from the government, some from your local authority, but it's really not clear and people don't understand the whole way that they interact or the way the system pulls together. And I just wondered whether you think that kind of muddies the water for us, really, and that maybe people don't even know. I mean, they understand the whole PIP thing, but maybe they don't even understand that they have these rights within the local authority.
Well, I think the issue about funding is interesting. In Scotland, they're talking about a national care service, and it being funded 100% by central government. But I personally think that's the right way to go, because having this, you know, it is partly funded by government grant and partly by local taxes. Both parties can blame the other for underfunding. I don't think it's a very sensible system at all. So I think it'd be much more straightforward to have a national care service which is funded 100% from general taxation. How much that would help at the individual level, I'm not so sure, Angie. I think to have a national care service funded 100% from general taxation is at some point going to have to be acknowledged as the only sensible way forward. So you've got a national care service alongside the National Health Service. How much that would affect the individual, like with the personal, you know, the equivalent of the PIP, I'm not so sure.
Okay, thanks.
First of all, Colin, thank you for giving such a clear and enlightening explanation of what has happened in the past and what's going on now. I just wanted to take up Jenny's point about campaigning. And I think if you're standing at a street stall and someone comes up to you, it's very easy to relate to things like potholes or library, well, for some people, libraries or parking and things like that. But if you don't know anybody, well, you might think you don't know anybody who is in need of social care, but probably if you have elderly relatives, or you might have somebody who is disabled in your family, or even a distant relative or a neighbor, if you start to think about it, there are quite a lot of people who do need support. They may not actually be eligible for one reason or another to get the council to see a social worker, or they not think they are. But I remember a few years ago, there were apparently 20,000 unpaid carers in Barnet. If there are 20,000 unpaid carers, that tells us that there must be more than 5,000 people who are in need of some kind of care and support, even if they're not eligible, or according to Barnet Council, not eligible for social care. So there are an awful lot of people who have difficulty getting out, who can't, you know, and who have mental health issues which prevent them from doing things, or they need support, or who don't know how to take their medication. There's so many things. Or how many people do people know, older people who have dementia? How many people do people know who have limited, who can't see properly, who can't hear properly? And it's probably more than they realize. And at some point, things can deteriorate so much that they will need social care. And there's probably, if they just think about their immediate family and people they know and start to add them up, it counts to a lot of people. And then if you think how much support, if they think about how much support they're getting, well, they may then perhaps want to think a bit more about social care. For instance, if they know people who are in hospital who come out who've broken their hip, and what happens to them. So things like that, that's all.
Yeah. So it's just a matter of us tapping, or
trying to make a connection that's more real for them, I suppose.
Yeah, so it's a matter really of how we phrase it and how we
Yes. Yeah. Yes.
Thanks. Helen?
The one of the big developments in the last 2 years has been the way in which COVID funding has been made available to councils in order to provide initial support for people being discharged from hospital, and it's all been done provided. I mean, staggering numbers of people have had support, and with the brusquest of assessments, because the need meant that we weren't actually able to see people, and we did the best we could. However, what that means is that social services and the health service have thought, that's not bad. It keeps people moving through, moving through the system, because the big issue is about how people have previously been, waited, a bit longer for an assessment, and certainly waited longer for support services to start. So I imagine that in the health and social care bill that's going through, that there's more thinking going on about how they can make this a much more permanent scenario. And I think that for a lot of people, their first contact with social care is through being referred in the hospital, as Janet said, following an operation or some illness, and it's an interesting experience, because we are covered by the Care Act, but actually, if I'm honest, we have the scantest regard to the Care Act, really, and certainly what we get is effectively like a prescription from occupational therapists saying this person needs twice a day care, or 3 times a day care, or whatever, and they'll sort of highlight some of the issues that the individual has, and I kind of think that people will put up with that for a couple of weeks post discharge from hospital, and for that to be a bit of a descriptor. But if that gets very embedded, then it is a complete step backwards in terms of practice, because it relates to people in a crisis rather than people, how people want to live in their lives. And so the reviews post discharge from hospital address the issue of how do you want to carry on living your life, and I am not clear that we've got anything like the resources needed for people to address the things that they want to. So yeah, I mean, I don't know why I'm saying this, but I just it's just another dimension, I guess, that I wanted to highlight in terms of what's going on in the world of social care.
So Helen, when you say we don't have the resources, do you mean the council doesn't have the funding, or you mean no?
I don't know. I mean, we've got quite an issue at the moment in terms of personnel who can, stick around with someone to get them properly sorted. There is an enormous waiting list for people to actually have a proper assessment, and one of the quickest, and the number of times you can see when somebody comes into hospital and we look at their record, they have had recent contact with social care, but they were never seen by anyone. They've been asking and asking and asking, and they never got seen, and then bang, they end up in hospital. And of course then, yes, they do get seen. That ends up being a bit of a gateway into getting an assessment. And we always say to people, because sometimes the hospital encourages people to leave, if they can bridge the gap in care, as they say, but we try and encourage people to stay so that they actually do get the assessment.
Sorry, Helen.
And now, if I
Can I
can
just ask where Helen works? Sorry, why do you work, Helen? I didn't realise.
I work for the council, but based at the Royal Free Hospital.
The Royal Free. All right. Thanks. Yes. Thank you.
And if I'm not mistaken, the new health and care bill will remove the duty to assess someone in hospital before they are discharged. So it will be even more horrendous because people will be discharged home to wait for assessment. So that's a disaster waiting to happen for many, many people. But what you're saying, Helen, is when we come to think about campaigning about these issues, we also need to campaign for more social workers recruitment, or for recruitment of more social workers. That's what you're saying.
Yeah. I mean, it's so that people can dedicate the time to, to make sure that, as far as is possible, people's, the needs of the person they're assessing, they're sorted,
Yeah. So, and that goes back to budget. I've got Bo and Jeanette and Maria, and I encourage people to look at the chat because there are some interesting things that people are putting in the chat. I will try to find a way to copy the whole chat afterwards. Bo, I think you first. You're next, sure. And then Jeanette.
Sure. This is just a quick one. I just wanted to thank Colin for just all that chat we just had as well, because even stuff that I didn't know, and I thought I knew everything from Colin, but that was great. I just wanted to ask Helen actually, when you said when people are admitted to hospital, and eventually that's when they, it's the assessment is almost enforced then because it's this crisis or whatever. And you said that when you look in their records or whatever, they've already been asking for social care. What does that look like? Like how would that have been implemented? Would that have been by a social worker and I'm just confused as why that would have been overlooked so often, if that makes sense.
It's not overlooked, but it's about having somebody available who can then do the assessment and
but was that referred by somebody else? Would that have been by a social worker?
But the process is that you call social care direct, or whatever you call it, a first point of contact, and then they need to put a social worker or an assessor or social worker on your case and get them to meet you and do the assessment, or and that's where the backlog begins to be created, because you have contacted social care direct, if that still exists, Helen, and they record that you asked to be in touch with a social worker, and now you get into a waiting list.
I think this is where, sorry to interrupt, but there's currently apparently a 12-week wait time to be allocated a social worker. So I'm presuming that a lot of these crises happen during that 12-week period.
Yeah. Thanks.
Sure. Okay.
Jeanette and then Maria, and I can see that we're gonna run over time. Is that okay with people?
Yeah.
Okay. Jeanette, go for it.
Hiya, thank you very much, Colin. Sorry I missed a bit of the middle chunk because my internet cut out. But I saw this morning on Twitter that Plaid Cymru have secured a commission to look at implementing a national care service. And I know that Scotland are doing it already. So one of my questions is that, do you think that this is going to be really helpful in a campaign to get this in England? And also, my blood is boiling listening to all this, right? Because when I think of my daughter's assessment, and that basically she was told, get lost, like you can dress yourself and you can get yourself to the toilet, and so you were entitled to nothing. And there were so many mistakes. I think you used her report as an example or something, Tiz said anonymously. So am I right in thinking, because I did Charlie sent me the stuff and I did half of it. I didn't manage to do all of it. That also my daughter's living in one room, which really, really affects, she's got multiple conditions, and it affects all of those conditions. So am I getting this right, that if I can get all this together and push this stuff from the advice that you've given out, what Charlie's done, that and she lives in Harringay, not Barnet, that she's entitled to be to social housing?
My position is this: if you do an assessment, a self-assessment, or you do an assessment as your daughter's advocate for her, which the Act allows you to do, if you do it in the right way, and that means doing it according to the Care Act, which Charlie's website takes you through, then you will be in a very strong position to take that to your council. Whether it's Harringay or Barnet is, it depends on who's financially responsible. But if you make out the case based on well-being, you will put the council on the back foot. Now, that's as much as I could promise, because quite how councils, behave and what decisions they make is a matter for them. But you will be in a strong position. And if the council doesn't respond accordingly, you do have recourse. You have recourse through the ombudsman, and that can work. So it's step by step. The first is, my advice is, don't just accept what councils put before you, because the chances are they have not followed the Care Act. They claim to be following the Care Act. They say they are, but actually it's not that difficult to demonstrate that they're not. I mean, yeah. One of the difficulties with this is, the website makes it as simple as possible, and Charlie's making it simpler still, which is great. But I still think people will need support to go through it.
Thank you. And also, what did you think about my other question about Plaid Cymru doing that?
About Plaid. Well, look, I'm quite involved with what's happening in Scotland. I've been poking my nose in there. It's interesting. I would say it's in the balance whether or not Scotland does create a national care service along the kind of lines I've been talking about. They had an independent review by a guy called Derek Feely. He reported last February. It was an excellent report, and it said that there has to be a whole change in culture. The eligibility, the process I was talking about, has got to go, and that people's social workers should be identifying needs alongside people, co-producing needs, not starting from finance, not starting from eligibility, and exposing unmet need. That was very clear and very plain. The government, as though is shying away from it. So the issue is going to be whether or not there can be, either from the professional groups or from the Labour opposition, possibly the Green Party, possibly even the Tory party, challenging the SNP and saying, you've got to come back to this central question, because what Scotland is doing is saying we're going to create a national care service, and it's about structural change, that they're going to put children's, adults and everyone else into the same service. And structural change, we all know, is just that. It doesn't change anything. So there's a big issue going on in Scotland, and what happens over the next probably 3 to 6 months will determine what happens. I hadn't heard about Plaid Cymru. I'm not surprised. And Wales could be the one to watch, because the First Minister there is an ex-social worker, Mark Drakeford. He's a bright guy. I would love to get talking to him if I could find a way of doing that. I've got a few contacts in Wales, but it might happen in Wales.
Aren't they?
What will happen in England, though, I just don't know. I think England is in a very precarious position because the white paper that was published last year avoids all of this. It doesn't even touch it. It doesn't get anywhere near it. And the fear is social care will just become a subsidiary of the NHS.
It will. Which it has been since the beginning.
Yeah, so I think social care in England is in a very perilous position. We've got to get cracking with our work, basically.
Okay, thank you very much. Sorry I can't be on camera, but I'm unable to sit up because I've broken my coccyx and I can't sit up. So I had a meeting as part of the Barnet Involvement Board, of which I am a member, and on Monday, and those points that I've put in the chat are quite important, because I feel, and I've been targeting Barnet Council Social Services about how to improve social care. And I have, the first point is they have agreed to include not only adult social services, but to bring in young people and children's services, so the transition is better. So that will be discussed at future meetings on how to improve it. Then the second one is that they are setting up working groups in order to tackle all the issues that I have raised about the proper workings of social care and how social workers aren't able to bring forward all the assessments and needs of people that they have. So they have agreed to bring in not only Barnet social care, but also the NHS, because they are still working on the government's collective workings of putting the NHS and local authority social care together as one resource or one budget. So they, Barnet Council, have got to try and split whatever is needed between them. And the CCG is having huge problems on how to fund it. So there's going to be, I think, a positive way forward, and maybe Charlie can also take this as part of the campaigning on how to include all parts of our community, not only the existing ones, but also the new ones that are coming in that will need, either through the hospital or self-assessment, or whichever way they need to get social care budgets. So if you can, as Terza sends out all the bullet points that I have put down, and if they can go out to our members and to other people to say, get involved in this, because if we can change the way that Barnet Council and Barnet Social Care Department works, it would be so much better than having to knock our heads against brick walls, because, as Colin said, it doesn't really improve. We've got to fight and nothing actually happens in the long run. So if we can change their mindset and their policies and bring forward how it is done properly, that, as far as I'm concerned, a benefit for everybody. So if we can take that forward, there is a meeting on the 24th of March, Thursday, the 24th of March, between 2 and 3:30 of the Adult Social Care Working Group, who will be discussing this. So if they can hear from more people than just me, it would be really beneficial. So can I invite everybody to do that? Thank you. Lovely to see you all.
And lovely to hear you, Maria. I'm really sorry that we can't see you, and sorry about your accident. But thank you very much. And I think that, well, I don't know if it's realistic to get to the meeting on the 24th, but if anyone can, I don't know how they will find about the meeting. What you were basically saying, if I understood you correctly, is again, how can we include more people, knowing that this issue is touching many more people that than the 5,000 they say that there are service users, and how can we campaign about these issues? So I think at the moment, the campaign, the Forum for Independent Living, sorry, I missed this name earlier, and the campaign for real care is the focused work on the implementation of the Care Act that we are doing in the context of a disability rights campaign in Barnet. There's a lot more work, of course, to do. And I think we see here that there is a scope to broaden it and to go to other campaigns in the context of social care improvements and disabilities rights. So I think we will need to get back to it. I don't know if you found this is a fair summary of this, I think, an excellent discussion that we had here, or Colin, you or anyone want to add a couple of more words, being that it's 8:24?
Can I just say very briefly, to thank you, actually, to thank BAPS. You've made it possible to get us, for the small group to have got as far as it has. Without you, it wouldn't have happened. I'm not aware of it happening in any other local authority. It could have happened in any one of the 152. But it's because of your concern about the quality of public services that this is happening. And I hope you stay with it, because in many respects, the work has just begun. Yeah,
definitely. So thank you very, very much, Colin. It's an opportunity to say huge thank you for everything that you've been doing, helping residents in Barnet, all these years that we've been working together. And thank you very much for today.
It's a pleasure. It's a pleasure.
Great.
Bye-bye.
Thank you.